is your show. You can bring up whatever you like toll-free at 1-800-259-9231. That's the SACL CAI toll-free line. And it's Ian here with you.
And Wayne.
And Mark.
800-259-9231. Join us on our website, freetalklive.com. Features for free, so enjoy those, including the live streams. We've got a broadband version of the show and a dial-up version, both for free for you at freetalklive.com. Sound money is under attack. The Liberty Dollar offices were raided by the FBI and Secret Service on November 14th, and all of its precious metals, computers, and records were seized. Your help is urgently needed. Go to libertydollar.org and sign up for their updates and register for the class action lawsuit. Don't let the government steal your money and destroy the Liberty Dollar. That's libertydollar.org. So I said we're going to talk about the Canadian health care debacle. Of course, as you may be aware, the Canadian system is something that many U.S. politicians are looking towards for an example of what they want to do to the American healthcare system.
Right, not because it's good for people or not because it will fix the healthcare problem, but because that way they can get in charge of that much more money.
Yeah,
they're going to have to take more money. It's going to come from somewhere.
Now, they'd like you to think that socialized healthcare or universal healthcare or single-payer healthcare, whatever you want to call it, is this wonderful, just cure-all. This is the solution. This is the solution to the healthcare crisis in America. But no, this is a problem that is going to just make things worse. And we've talked about it before. But there's some real good concrete examples that Jim Babka from downsizedec.org has put together in an excellent little article that he emailed out a little while back. He says when real market prices are unavailable to balance supply and demand in the healthcare sector, when prices are set by government decree or distorted by government funding, the consequence can be death. It's easy to miss the truth if we only focus on anecdotal personal testimony. Talk to people from Canada and the UK, and you're likely to hear glowing praise for their national health services. Alas, there are fundamental problems with this kind of testimony. People living under national health services have little or nothing to compare them to, and we've actually heard from people in Canada who've told us that in high school or in Canadian government school, they teach you that, hey, our system's the best. Our system of healthcare is the best in the world. And, well, if you've never experienced anything else and don't check their claims, then you're going to grow up believing that to be true. In the same way that many Americans believe that America is the freest country in the world. Mm-hmm. In some areas it's free, in other areas not so much. In some areas Hong Kong has more freedom than America.
If you think you're free, try not paying your taxes for a year.
Right. Small medical problems easily fixed are far more common than those that are life-threatening. Thus, most personal testimony tells us little about how well major procedures are handled. Patients that survive major medical problems in such systems tend to assume that the system works, while those who die because of the system's failure are unavailable to testify. This is the familiar economic problem of the seen and the unseen. The successes are seen, walking among us, while the failures lie buried, unseen and silent. Michael Moore, in his recent film Sicko, makes dramatic use of horrifying anecdotes of failure in the American system. We say, good for him. We too reject America's current system, precisely because it's already halfway to the type of system that Moore is advocating. We applaud him for exposing the failures of America's half-socialized system, but we must criticize him for not telling the whole story. If you watch another movie called Dead Meat, you'll hear equally horrifying anecdotes about the fully socialized Canadian system, which is the kind of system that Moore wants for America. Though Moore favors the French socialist system, future messages will show that there is really no fundamental difference between France and Canada. For now, we just want to compare movie anecdote to movie anecdote, and Dead Meat, again, that's another movie, is about Canada. Here are some of the things that you'll see if you take the time to actually watch this film. You'll see a Canadian woman who waited 2 years for her free cancer surgery, only to have her appointments canceled twice. Death came before her surgery did. So she waited 2 years, and then her appointment, sorry, we just had to cancel your appointment. Come back in another 6 months.
Good luck with that cancer stuff, though.
Yeah. But it'll be free when you finally come back.
They probably didn't even send her a card.
A Calgary woman was in excruciating pain from worn-out knee cartilage. She had to wait 16 months for her free surgery. It took so long she became addicted to free OxyContin. The result? More time on another long list, waiting for free drug rehab. Another man needed urgent neck surgery. His free doctor told him there was a 2-year wait for a free initial consultation. Do you understand? He would have to wait 2 years to get consulted. Then once he gets consulted, then they'll give him whatever their diagnosis is, and if they determine that he needs to be fixed in some way, again, urgent neck surgery is what he needed. They determine he needs to be fixed. Who knows how long it's going to be before the actual operation will occur? And we've also seen stories about
there's no market motivation for these people.
Right.
Look, they're going to get paid the same whether you live or die. And I'm sure the doctors and nurses care. I know they do. But I know that they care more and they act better when they're properly incentivized by the marketplace.
Right, when they actually care about their customers and they're actively looking to satisfy them. In this case, it doesn't matter if your customers are satisfied or not. It won't make a difference to your paycheck.
And you know something? The special in September called Sick in America, whose body is it anyway?
John Stossel.
John Stossel, that was excellent.
Yes, it was.
And he actually interviews Michael Moore and calls him on the carpet on a lot of these ideas, and Michael Moore really didn't have a good answer for him.
Yeah, that was good. I think if you dig around on the Internet, you can probably find that. Anyway, Michael Moore doesn't really cover the anecdotal horrors of the various socialist systems, even though there are plenty of such stories available. I mean, that was just there's just a handful mentioned here. But if both sides in a controversy can each produce horrifying anecdotes, then what have we really learned? How can we choose between the competing stories to arrive at an optimal policy? We should submit that anecdotes can tell us little more than this, that the American system of half-socialized medicine has big problems, and foreign systems of fully socialized medicine also have big problems. But what the anecdotes can't tell us is how the half-socialized American system compares to the fully socialized foreign systems, or how either approach would compare to a totally free market system. What we need instead of anecdotes is statistical information that can give us a well-rounded picture. Statistics may lack the emotional impact to get your blood pumping, but they could provide the crucial evidence to keep that you need to keep your blood pumping. We're talking about statistics like these. British colon cancer patients had to wait so long for medical attention under their socialized healthcare system that 20% of the cases there considered curable at the time of diagnosis had become incurable by the time of treatment.
So 20% of cases became incurable because of the wait.
Right, 1 out of 5 people. Just lives thrown away by the system. 71
and
patients.
This is what happens when you rely on the government to provide your health care. I mean, I'm sure there's going to be some successes, but I would imagine there's going to be a lot more failures.
Yep.
I mean, would you want to rely on the government to pay for your food?
That's a frightening idea. 71 patients in Ontario, Canada died while waiting for bypass surgery, and another 121 had to wait so long that there was no longer any point in operating. In Britain, on an annual basis, waiting lists cause a denial of treatment to 9,000 people for renal dialysis, 15,000 for cancer chemotherapy, and 17,000 for coronary artery surgery. This is death by waiting list, death by rationing, and death by government. But how does the U.S. system of half-socialized medicine compare? The available statistics are so abundant and so in favor of America's half-messed-up system that it's hard to pick what to show in this short email. But for just a taste of the available data, consider these comparisons of where we've been in comparison to Britain and Canada and where we still are. Back in 1978, the U.S. rate for pacemaker implants was more than 4 times higher than that of Britain and 20 times higher than that of Canada. Plus, the U.S. has 3 times more CAT scanners available per capita than Canada and 6 times more than Britain.
I wonder why that is.
Now,
well,
go ahead.
I was just 3 times more than Canada and 6 times more than Britain?
That's correct. CAT scanners.
But, I mean, I'm thinking there the population of the United States is 10 times what it is in...
It's per capita.
Okay.
3 times per capita.
Okay. Didn't hear that.
Today, Britain still has... Now, what about over the years? That was in 1978. Well, today, Britain still has only half as many CT and MRI scanners per capita as the U.S., and the disparity with Canada is similar, not only with regard to scanners, but numerous other treatments and diagnostic tools. Things haven't really changed much over the years. National health services continue to lag behind in almost every category. How about this? In 2001, how many patients had to wait more than 4 months for surgery? I'll give you the answer here in a moment. 800-259-9231. What percentage of patients in 2001 had to wait more than a third of a year for their surgery? We'll give you the details and take your calls about whatever you want. This is Free Talk Live.